Tests and investigations. This is part of a series of short videos to explain what an enlarged prostate, otherwise known as benign prostatic enlargement or BPE, is. This video highlights the tests and investigations you might need to have. A number of tests can check for an enlarged prostate. Some will be done by your GP, while others will need to be carried out by the urology team in a hospital. When you visit your doctor, they will ask about your symptoms. It may be helpful to keep a record of them, so you can share which symptoms bother you the most, how long you've had them, if they're getting worse, and how they are affecting your life. You may be asked to keep a bladder diary over 2 or 3 days. This is to note how much and what you drink, and how much urine you pass. You may also be asked to fill in a questionnaire. The International Prostate Symptom Score, or IPSS, is a survey used to assess how bad your symptoms are and how much they affect your life. You may also be asked to give a urine sample. Your doctor will test this for diabetes or infection that could be causing your symptoms. You may be asked to give a blood test to check that your kidneys are working properly. You may also be offered a PSA test. PSA stands for prostate specific antigen and is a protein produced by the prostate. A raised PSA level can be associated with a range of prostate conditions, such as prostatitis, which is swelling of the prostate cancer, or enlarged prostate. Your doctor will talk to you about this test beforehand. Your doctor may ask to do a physical examination of your stomach and penis, and also a digital rectal examination, or DRE. This allows your doctor to feel your prostate through the wall of your back passage to get an idea of the size of your prostate and any obvious irregularities. Other tests are carried out in a hospital urology centre, such as urine flow test. To do this, you will need a full bladder, as you will be asked to pass urine into a machine to measure the speed of the flow. If the tube that you pass urine through, the urethra, is blocked by the prostate, the speed of flow will be slower. An ultrasound scan is often performed after a urine flow test. This is to see how much urine is left in the bladder after you have passed urine. If the cause of symptoms is not clear, urodynamic tests can be carried out. These tests look at the way your bladder is working. A fine tube is passed into your bladder through the penis, and a second tube is inserted into your back passage. This measures the pressure in your abdomen so it can be compared with the pressure in your bladder. Once both tubes are in place, fluid is run into your bladder to try to recreate the symptoms you have at home, so the medical team can see what may be causing them. A flexible cystoscopy involves a thin, bendy tube, about the width of a pencil, being gently inserted into the urethra and bladder. The tube has a camera on the end, which allows the clinician to look inside. You will be awake during the procedure. You may not need all these tests. Your doctor will discuss with you which are best based on your symptoms. Some patients may feel embarrassed or worried about these tests, but please be assured they are routine procedures, and the clinical team will ensure you feel as comfortable as possible throughout. There is more information online. Please see these websites. If you are concerned about any symptoms, you should discuss these with your GP.